My fellow Gomanians, the Director of Public Health made a decision a few months back. He looked at his budget, he looked at all the services he has to provide. These range from welfare to hot meals for bedridden Manamco to the medically indigent program for people who need but can't afford health care. He prioritized everything, then he made a decision. He looked at one service where the funding went from $1.1 million to $850,000, and then he got creative. He went to the people providing that service and asked whether they could provide the same service at a lower cost. Their leadership said no. So he went to other people and asked, and they said yes. At the end of the day, the Director of Public Health got you the same services for $300,000 less out of your pockets every year. What I'm talking about is the senior citizen centers. Lost in all the debate last week was the point that Jim Gillen, the Director of Public Health, had his priorities straight, and he knew very well that he wasn't toying with his own money, he was negotiating with yours. He wasn't going to sacrifice hot meals for seniors or MIP for sick patients or even bus rides for the Manamco to get to the doctor. When push came to shove and the political heat was high, he looked out for the Manamco and your bottom line. That is the Calvo Tenorio way. The entire government can learn from Jim's example. It's all about priorities. Let the SPEMA issue be a wake-up call to all island leaders and agency heads. The taxpayers of Guam don't have enough money to give the government to pay for all the services mandated by law. Put simply, there are way too many mandates and way too many of them are underfunded and not funded. Last year, we borrowed from the bank to pay you part of what you were owed for your refunds. We also cut millions in spending, but it's not enough. We need to cut millions more. This is why the governor's fiscal team is preparing a second round of cuts and revenue enhancements. We need to do enough to pay down the deficit and pay your tax refunds. We have to cut spending by prioritizing government services. Now, prioritizing isn't a verb meant to be used only as a soundbite in a political commercial. It is very simple and very real. It means education is the top of the list with your safety, health, and your pocketbook. And it's not the agencies themselves that are the priority. It is their core services that are the priorities that should get the funds. We simply can't afford to waste time on fiscal reforms needed by rushing to save every service without regard for the fiscal realities and the clear priorities of this community. We need to cut so we can invest savings into teacher pay that will attract the best teachers for your kids. We need more public safety officers to protect you and your families. We need to reevaluate all the programs for people living with disabilities and make sure that the programs are working with the greatest number of people. We need to invest in a healthier community so we're not spending so much on urgent and emergent treatment in the long run. We need to be reasonable, not reckless with the finite amount of money that the people give our government every year. And I'll speak the unspeakables because this needs to be said. When it comes to preparing students for life, who matters most and who matters least within DOE? What is more important, a hot meal for a bedridden senior citizen or a contract for a nonprofit organization? Would it be better to outsource bus operations or put together all mass transit operations under DPW and agencies that demonstrated it can do more with less? There are critical services, and then there are services that we would like to have but we simply can't afford. We don't have a choice. We haven't had a choice for 20 years except to raid your tax refunds. But there's only so much the executive branch can do. I have to tell you, we've been bearing the brunt of the fiscal reform. After all, it's our commitment to excellence and improvement of services. The executive branch, however, is not the only user of tax money for operations, though. The entire government has a fiduciary duty to cut costs in these austere times. If the priorities really are education, healthcare, safety, and finances, then everyone in this government has to do their part. And we can't buckle when the sacrifices are made and the going gets tough. If we're seriously committed to fiscal discipline, all leaders in our government have to forget that there's an election this year and together do what is necessary and what is right. Thank you, and Sizus Masi for your time today.